Okay, so we are moving on to common sleep disorders. I think it's important to know what these are. Okay, so there's a range of medical conditions that impair one's capacity, if you want to say that, to sleep well on a daily basis. Sleep disorders are on the rise in the modern world, and whether they are brought on by a medical condition or generally just too much stress. Insomnia, I'm sure you've heard of this one before. Persistent difficulty to stay asleep, and despite what they do, it's a terrible thing to suffer from. Chronic symptoms, at least 3 times a week, it can happen to them 3 times a week, or at least 3 months ongoing. And so 33% to 50% of adults experience some form of insomnia symptoms, and 10% to 15% of adults are thought to have chronic insomnia. So regular exercise, light therapy, CBT, tidying your sleep hygiene, which we went through, sleep hypnosis are all great ways to help combat insomnia. Then you have sleep apnea. So breathing interruptions during sleeping are a defining characteristic of sleep apnea. Snoring is one of the most frequent symptoms of sleep apnea as well. And this is one of the most dangerous sleeping disorders, believe it or not, as people are usually unaware that they have it until it's too late. Despite it causing loud snoring, people have dubbed it as a bit of a silent killer. So you have most sleep apnea falls into the following 2 categories. So you have OSA, so this is to block the upper airway. This is the main reason for it, and it's the most common sleep-related breathing disorder. Men, for example, obese people with a lot of muscle mass, and those with genetic syndromes that affect facial structures such as a cleft palate are at most risk of having OSA. Then you have central sleep apnea. It's usually caused by an instability in the body's feedback mechanism. Let's go on a little bit. I'm just thinking, guys, what I could do with these presentations, I could send you a copy of the presentation slides if you want that. Just let me know. Okay, and moving on to central sleep apnea. It's usually caused by the instability of the body's feedback mechanisms that controls the respiration. And SCA can also be an indicator of Arnold-Chiari malfunction. And obese people are also at a higher risk of this as well. When it comes to both OSA and CSA, the CPAP and BiPAP machines are the most effective treatment options for this. Restless leg syndrome. If you ever feel that, I've had it myself. It's believe it or not, imagine you've got your feet up or whatever, you're relaxing, and you've got this kind of tickly feeling in your legs. It's not nice, and a good way to combat this is cardio, getting cardio and moving. A little bit more about the RLS, also known as Willis-Ekbom disease. It's characterised as, intense impulses to move the legs while they're at rest, as well as throbbing, kind of like itching feeling and other painful feelings in the legs. So people with RLS are more likely to have issues with falling and staying asleep, since their symptoms are often while lying in bed. RLS can't be cured, although some patients find that making lifestyle adjustments like doing light exercise and stretching at night may help them the symptoms. And when I used to have that, and this was going back years ago before I actually started taking control of my health, and for those that don't know more about me, just certainly watch the video. It's on my website. and it tells you basically, my lifestyle wasn't the best, and I just wasn't looking after myself, and this was one of the symptoms that I did have. And certainly introducing a yoga stretching routine, which is going to be part of the course. You'll have access to yoga systems there as well. It certainly helped me. Stretching routine and a regular exercise routine certainly help overcome this. Okay, and moving on, you also have a sleeping condition called narcolepsy. This is a chronic sleep condition characterised by excessive daytime sleepiness and unexpected sleep attacks, and it can be due to a loss of muscle tone that makes people collapse or slouch over as they fall asleep. And it's a common symptom of narcolepsy type 1 with narcolepsy type 2. Sleep attacks also happen, but cataplexy is absent. Then we have REM, sleep behaviour disorder. So rapid eye movement. I'm sure you've heard of this before. We've covered this previously, and it's a sleep disorder. A sleep behaviour disorder is when you vocalise and make abrupt, frequent, violent arm and leg movements while having vivid and unpleasant dreams. So if your partner ever says you're suddenly moving during the night, I'll certainly look into this. Atonia, a transient state of muscle paralysis, is experienced by the body during typical REM sleep. So during REM sleep, we see an increase in blood pressure and brain activity, uneven breathing, rapid eye movement of the eyes. You can also dream. You can dream safely while lying still and having our brains active thanks to this temporary paralysis during REM sleep. Okay, and you have other neurological disorders including Lewy body dementia, Parkinson's disease, or multiple system atrophy. These all may be linked to REM, sleep behaviour disorder as well. Okay, let's talk about the risk factors of REM sleep behaviour. So being over a 50-year-old male, using antidepressants or other medication, or using or withdrawing from alcohol or drugs, Parkinson's disease, Lewy body dementia, or multiple syndrome atrophy. So just bear this in mind. These are things that you could certainly look into if you are experiencing sleep problems. So hopefully this course has been really helpful, guys. Some things, there's been a lot to cover, and what I'm going to do, because there's been so much to actually get through, I've actually put together a information document that you can look at. It's taken some of the main points from the course, because I know there's a lot in it, and when you're going through the course, just take notes. And take screenshots of the presentation slides there as well, and it's all about yourself, and just take things that you resonate with and feed this back to me, give me more information. And it's about figuring this out together, just knowing more about your sleep, looking at ways to improve it. And I'm so I'm just so happy I'm able to give you that. Just gives you more to think about, and hopefully you're enjoying everything I'm presenting so far. Says there's a lot to go through, and we're going to be going through a habitual course as well. I've got a nutrition course, a fat loss course, and also I'll be sending you over yoga information as well.